So my focus is on the care of patients with solid tumors, which is to say cancers that arise in a specific organ rather than cancers of the blood system, such as leukemias or lymphomas. And specifically within the group, I'll be focusing on caring for patients with cancers in the head and neck region, patients with melanoma, and patients with certain genitourinary malignancies, specifically kidney cancer and bladder cancer. I've always really been interested in science, and that kind of carried through into college and after. After college, I actually worked in a laboratory doing cancer research at the Van Andel Institute here in Grand Rapids, and that led me to apply to medical school. And I really applied to medical school with the intention of becoming a scientist, a lab-based researcher in cancer research. But it was quite clear early on in med school that I enjoyed and in fact even preferred caring for patients directly. So switched my focus, pursued training in internal medicine, and ultimately medical oncology. But I think really, what's exciting about oncology is the science. There's a lot changing these days, and the science is quite exciting, and it's really quite great and exciting to be able to offer those opportunities and those treatments to patients here in West Michigan. Some of the biggest changes we're seeing is really the dividends being paid from the research that's been done in the last 20 or 30 years, and that specifically relates to new classes of medications. Specifically medications that use and sort of harness the patient's own immune system to fight cancer, which is really a new way of approaching cancer treatment. And also using specific medications or molecules to target abnormalities in cancers, or so-called targeted therapy. Both of those approaches are somewhat new in cancer care and are really providing meaningful benefits for a lot of patients, including patients here in West Michigan. Cancer hematology is unique in that it is really a hybrid between a traditional community oncology practice and what historically has been the purview of an academic center. I think historically there has been a fairly marked distinction between care at an academic center and in the community, and that's starting to blur. That's particularly true here at Cancer and Hematology, and in some ways I feel as though we have the best of both worlds. We have the benefits of a community practice, but really the ability to offer what's offered at an academic center, and specifically clinical trial options, which in the past usually meant a drive.